All right, hello and welcome. I'm Dr. Joe
Thank
Mather, and I am joined here by Vicki, who graciously agreed to come chat with us about her SIBO experience. Hi, Vicki.
Well, hello, Dr. Joe. I'm here.
I'm glad you're here as well. I treat a lot of patients with SIBO, and I see a lot of patients who hear a lot of different stories about how hard it might be to treat SIBO, and I see a lot of people who've been sick for a long time because they haven't found the right solutions. And your case history just kind of checked all the boxes of the problems I see in the field. So will you share your story? How long did it take before you were diagnosed with SIBO?
Oh, well, I was sick with intestinal pain, pretty extreme for decades.
Yeah.
And it was only maybe 3 years ago, possibly four, when it was discovered that I have this thing called SIBO. And then it made sense.
Yeah.
Everything, because doctors I'd seen, no one knew what it was. They said, oh, try this pill, try this, try that. And then finally I had an answer. So I thought, oh, great, now I have a solution.
Yeah.
That took a while too.
And I'm remembering your story. And one of the things that I think confirmed that you had SIBO was that at some point you were prescribed some expensive antibiotics. What happened? What was your experience to the antibiotics?
Um, that came actually after I was working with a functional medicine doctor, but he didn't have the experience like that you do to really put it together. And I was
Mm.
trying all kinds of things, some of it on my own, some with him. And my experience with the antibiotics, I felt, and they were quite expensive, and I did feel that some things improved, but for a very short time, for
Right.
about a month. And I was feeling so great. Oh, yay, this is the answer. My doctor said, yeah, I don't really have many people who need to repeat this and it goes
Yeah.
away. Oh, yay. But then it came back and I felt, oh boy, here we are again, square one.
Yeah. Yeah.
And, and then I went to see a specialist, a gut nutritional specialist virtually, because she
This
was on
isn't
the other side of the world.
right. An online clinic specializing in functional gut health.
Yeah. And she seemed very knowledgeable and easy to work with, but the number of supplements I was on and the number of things she was treating at the same time, possible other issues that I have, possible,
Yeah.
overwhelming for my system. And I just felt a lot of pain still. And I thought, what is going on? I'm supposed to be getting better. And it was going to be a year of doing this and extremely limited diet as well.
Okay. So let's focus here a little bit. So
Okay.
you enroll in a well-intentioned, knowledgeable practitioner who I think is trying her best to help, but the treatment that is offered is very supplement heavy. And she says it's going to take a year for you to get better. And
At
if I
least.
remember correctly, the order of treatment that she wanted to work you with maybe started with potentially a mold problem, then maybe some detox, and then kind of eventually making your way to SIBO. Do I remember that correctly?
You do. Yes,
Okay.
exactly. The mold was the first thing to attack. And there were very expensive tests to start, very, very expensive.
I couldn't remember if she tested you or not. This is the thing that drives me crazy about the field. I'm going to get on a soapbox.
Yeah.
So many doctors want to start their patients out with thousands of dollars of tests. It's such a waste of time and money. You just don't need them to get well. You need to pick the right treatments, but these tests rarely point you to the right thing to treat. And in your case, they
Yes.
completely we're going to take you down a wrong turn, right? Because you did not need to treat mold. Some people do. You
Yeah.
didn't, right? And so it's so important for us to back up and just take a pause and say, wait, do we really need to spend thousands of dollars on labs, thousands of dollars on supplements, thousands of dollars on consult fees for a year? The answer is no. And so tell me a little bit about how we got there and what happened next?
Okay. So I was doing that and I called it my part-time job because it really was, and very hard to do everything. And I always felt like somehow I was failing because if I didn't do the diet perfectly, or and thinking into the future, oh my God, how am I going to go away? How am I going to go out? So I was frustrated. And I was visiting my sister in Atlanta, which is far from where I live. And serendipitously, I happened to go out with her to celebrate her birthday with some friends. And I mentioned, oh, there's so many things I can't have here. I can't eat this again. And the woman across from me, a friend of hers, said, well, why can't you? And I said, oh, I have something called SIBO. She said, oh my God, one of my daughter has SIBO. She's had it for decades and decades. And she was so frustrated until she found this doctor. I don't know his name, but he's in New Orleans, and you should be in touch with my daughter. I called her, patient of yours. She had a similar experience of having SIBO for many, many years and was treated by you as well as another friend and found almost instant relief. She told me it's now a year and plus time and she's still feeling better. So that convinced me that I need to go in that direction, because sometimes you feel a quote, well, forgive me, gut feeling
No, it's the best feeling.
that I had to go in that direction. And then I came to see you.
Oh, that's great. I didn't realize that the chain was as tenuous, perhaps, but that's fantastic. I'm really happy that we got to work together because you've done great, right? So
Yes.
you came in, and I'd like you to, how did I treat you, or what worked, maybe what didn't work? Tell me what happened with treatment.
Okay. First, I felt a doctor-patient rapport, and that is really key for me to feel that. I felt the trust, and I felt I could see your knowledge and your experience, and that was really hopeful. So I came in and felt very hopeful. You had me get off all of my supplements, which was freaky. I said, really? I had thousands in there. You want me to get off all of them? Yes, I do. And
It's
you allowed me to get a special donut. I can't remember the name of it. They make only in New Orleans,
I
which,
may well, you flew to see me to establish care with me, right? You're out of state, and
yeah, right.
even though you had SIBO, you had to get beignets.
I had to get a beignet.
The New Orleans thing. So it's full of sugar and
Yes.
dairy and gluten, and you just have to eat it anyways.
And I still felt okay because I'd gotten off all the supplements. So I
Yeah.
felt much, much better
Well,
immediately.
let's start there. So I see so many patients coming in and they're on 24 things and they don't know what's helping and they're spending all this money. And
Right.
in the back of my head, I'm worried that they're reacting to some of these supplements, or they're just filling their gut with binders and colors and excipients and extra stuff they don't need. What
Yes.
happened when you stopped the supplements?
I felt better. I
How
felt
quickly?
almost immediately. Almost
That's it.
immediately. I felt it was like, oh,
Right.
wait, I don't have a stomach ache today. Oh, yes, I'm not on a million supplements.
Exactly. That's functional medicine. Functional medicine, the marketing department of all the doctors want to make it out that you have to get the test and the test will give you results and you treat that result and you get better. But
Right.
functional medicine is thinking about, why is a patient sick, fixing that. You were ill to some degree
Mhm.
because you had been treated inappropriately. You were given too many supplements and that was hurting you. So the functional approach is to take those things and put them away. And you got better very quickly. That cleared some room for us to then say, all right, SIBO time, Vicki.
Right. And then I remember the first thing you wanted to do, and it was the opposite of what I had been told before,
Yeah.
was to put me on a lot of probiotics and different kinds
Yep.
and really improve that gut flora and, all of that. And I really had very little to no bad effects from that. I
Yep.
think it really did work. And then after that, I can't recall how long, a month or 2 months probably. Then you started me on some antimicrobials to approach, the SIBO. And I did well on those as well. And we added a little bit of some of the stuff I was doing before. I'd write to you, and you're very available within a few days, you were always back in touch, answering any question I have. And that is also, I never feel abandoned. I feel like, okay, Dr. Joe's there if I have questions.
I like my patients, Vicki. So it's particularly easy to answer questions from you, right? You're awesome. From my recollection, exactly correct. We got you on probiotics, and that took you up a level.
Yeah.
I think some of the constipation and the nausea in particular came down. And so from my chart notes, about a month in, you had seen steady improvement from before. So you got off the supplements, you got better. We started the probiotics and a gentle diet, you got better. Then when we did the herbs, you got a bit better. And so that took about 3 months. So not a year, 3 months, and more or less. And that's what I see with most general SIBO cases, is that if you're not getting that kind of dramatic improvement in 3 months, the patient doesn't have SIBO or you're doing something wrong, right?
Right.
And were you surprised to not react to the herbals or not react to the probiotics?
I was because of my experience before. And if I had a reaction, it went away as my body adjusted.
Yeah.
And also, one thing I also really appreciated, although we did go on a low FODMAP diet.
We did. Yep.
Yeah.
Well, not we. I didn't. You did.
I know. I meant to say, well, I don't know. Maybe you're really empathetic and you do it along with your patients.
Yeah.
So anyway, yeah, I did it.
Yes.
And but what I appreciated was that you said, look, you do the best you can, 80%, and if you go off one day, you go off, and it felt much free. I felt much freer, although I kept checking in. I don't know if I'm doing this as well as I should be. And you said, oh, if you're feeling better and you're doing the best you can, then you're doing it. And that was a relief.
Yeah. And you kind of have to fight against the current to get to the truth sometimes. And when the standard truth of all the diets is you have to do the SIBO diet, the Candida diet, the low oxalate diet. If you don't do it perfect, the lectin diet. If you don't do it perfect, you're going to poison your immune system and you have to restart everything and go back to phase 1 instead of phase 2. It's all nonsense. Right. People don't need to be that strict to heal. And I kept saying just that. I was like, Vicki, are you feeling better even though you have some FODMAPs? You're like, yeah. I'm like, well, then it's fine. And that's the sort of way that people can actually heal, not the dogmatic eating disorder or restrictive types of diets. That doesn't lead to healing, and it's not fun. So why do it?
Exactly. Not fun.
Exactly. What would you want someone who is just diagnosed with SIBO to know?
I think the first thing is that there is absolute hope, and there are solutions out there. Sometimes it can take years to find them. Yeah. But I feel extremely positive and optimistic about this continuing. And I know that there's tweaks here and there, and that's okay. That's part of it. But it's not a life sentence. No. Although it can feel that way if you've been dealing with something you don't understand for decades. Yeah. But there's always hope, and don't give up. Just, keep searching for what is right for you. I am so happy that you said that, because I see that in my clinic all the time. And I just want more people to hear that type of message rather than the doom and gloom on the internet forums, or it will never go away. Right. Because I think that simple, gentle treatments go a long way with SIBO, and I see it help people all the time. Thank you for sharing that perspective. Yes. Maybe if you don't mind, we can circle all the way back to the antibiotics. And you took rifaximin plus either neomycin or metronidazole. Is that correct? I took rifaximin and neomycin. Those rifaximin and neomycin. And I don't know how much you paid for rifaximin, but I've seen some patients be quoted $900 for a 14-day course of medication. And so this is a medicine that works well for hydrogen dominant SIBO.
It doesn't work for methane SIBO, and so it doesn't help all cases of SIBO,
Wait a
right?
minute. I had the methane and I
Yeah.
paid about $800 for that 1 2 week. Um,
That's why your doctor gave the neomycin as well. So the neomycin should help with the methane, and the combination can work pretty good. It's pretty strong. But
right,
here's what went wrong, right? So the doc didn't have the experience to know how important the health of the microbiome and the health of the intestinal wall is. And so he just threw the medicines at you, or she threw the medicines at you without doing the prep work that I had you do. So the prep work I had you do was stopping the supplements to let the gut calm and heal, to
mhm,
get on the correct diet, but not an overly strict diet, and to heal with high doses of a broad number of probiotics. We
right.
did that for 4 to 6 weeks before. I mean, that's my standard practice, is 4 to 6 weeks before trying herbs or antibiotics. And since I've done that, it's made all the difference. I rarely see die off, and I see the antibiotics work better when you use them with probiotics. And I see the chance of SIBO coming back drop a whole lot.
Uh,
Everything works better, right? So there was a method to the madness of having you do things in a stepwise fashion. I think
yes,
that the reason that you got relief initially and then it came back within a matter of weeks was just that.
yes. There was no preparation. It's take these and you're going to feel a lot better. So,
The other problem is that, particularly if you're not doing that prep work, which everyone should do because it saves money, it's easier, it makes treatment faster, it's better for you long term.
yeah,
But if you're not going to do that, people need to know that rifaximin insurance companies, when they cover it, right, they don't do what they're supposed to, but
yeah.
they cover 3 courses in a year. And so if you get 50% improvement on rifaximin, you should follow it up with another course, maybe even another right after that, right? So sometimes for these persistent courses, and people have been having SIBO for years, you can't expect that to just be gone in a 2 week period. So that's the other thing that I commonly see doctors who don't treat this often expect it to go away like a skin infection where you just give an antibiotic and in a few days it's gone.
Right, right. And that was not at all explained to me. And so I had this misconception that I was going to be fine. It was just
Right.
going to,
And
so I was disappointed.
it's a particular form of horrible to finally get relief from symptoms you've had for decades or years, to have it come back within a few days. You're like, it's finally gone. And then as soon as you grasp that hope, you fall. And it's like,
Yeah.
no. Um,
Exactly. And it my SIBO, I did have another test when I worked with the nutritionist who was a gut specialist,
yeah.
and it showed very, very high levels of methane
Yeah.
SIBO. So I was absolutely positive that it had come back.
Yep. Yep. That's kind of the story. And again, that's why I wanted you to have be on here, Vicki, because you've got so many of the classic pieces and pitfalls. I'm so happy that you're sharing the story. Is there anything else on SIBO that you'd like to share with anybody who's suffering from it, who's struggling with it, who doesn't know what to do? Maybe anything about the diets?
Yeah. I mean, I find that the low FODMAP diet has been helpful.
Awesome.
And yes, again, I'm certainly not perfect at all, and I don't count how many FODMAPs. I'll look at the foods that I should be eating and I
Yeah.
slip in a few in there. But
Yeah.
what I have found is you can be really creative in your cooking. And my daughter actually gave me a cookbook for,
Awesome.
so that's that. When I remember to use it, that could be very helpful too. You get into patterns, and what's interesting too, in fact, I just saw something on Netflix. It was, I can't recall what the name of it is, but it's getting a lot of press right now about the whole thing is about the gut and the micro.
Nice.
I don't know if you've seen it, but it's
I have 3 kids. I see
okay.
kids movies.
Well, you know what? They might be interested because there are a lot of little cartoons showing
All
the bad
right.
bacteria and the good bacteria. It's actually very cute, but it was so informative about how our gut is. It gave me a lot of understanding, even though I have a good understanding it really helped me to grasp how important it is to
Yeah.
really uh, feed nutritionally feed
Yeah.
your biome in the best way possible. So that's another thing I think I would recommend to people is to become informed about what our gut really needs.
I like treating the gut, not just because I can see cases like yours where you've struggled for decades, and within a few months we can just turn you around and get you doing great. I think your last visit, you said you were 85 out of 100 overall from way below that. And so, I mean, that's just a huge win. But I love treating the gut for cases in which someone comes in and they've got psoriasis or rosacea, horrible skin conditions, and then the same types of things that we did together, I do with them. And a month later, I had a patient yesterday, Dr. Joe, like everyone at work is saying how good my skin looks and they want to know what I'm doing, right? That stuff is fun too. And so the gut, I think it punches above its weight in terms of an organ system. When you fix it, everything else can kind of settle. So we see mental health conditions improve, we see anxiety and energy and sleep, skin health. And so it's one of my favorite things to treat, and one of the reasons I spend so much time harping on it.
Oh. And and the fact I love this too, that the gut is another brain.
Yeah. You want your immune system to work better? Well, you're probably going to treat the thing that has the second, most density of nervous tissue in the body, right? It's right there. You
Right.
put things in your mouth and it goes in the intestines and it hits all those nerve cells. It
And
really
then
is, it's pretty elegant.
the direct connection between the brain and the gut too.
It's
You know,
just,
I
it's
mean,
amazing.
I know, it really is.
Do you want to pivot quickly and talk a bit about your experience with preventing Alzheimer's? So you came in and you had done Dale Bredesen's protocol.
Yeah.
uh, and I'd love to hear your experience going through the Bredesen protocol.
Okay. So because I have a very, very high um, history,
Yep.
big in of Alzheimer's in my
Family history, and
yeah,
you have a genetic marker ApoE4. You're a 3-4, so you have one copy
copy of
of
it.
ApoE4, which bumps your risk of Alzheimer's.
Right. So naturally, when your parents, your grandparents, your uncles, so many people on
Yeah.
both sides, there has been a fear. And I've done all this stuff, including the Bredesen method, which was protocol, which was very intense.
Yep.
Again, I mean, even more so than the gut
Yes.
protocol. It encompassed everything. And you're constantly having to test your blood sugar and I lost too much weight on it and I
Mhm.
was dizzy and I ended up, even though it made sense and they've actually turned people around who had Alzheimer's and they were actually able to move backwards, which was amazing because there's no cure. It was just, I had no enjoyment in eating and living. And it just was so overwhelming that I left
It,
it, except for pieces of it that I take with me.
I see that often. And when I first started practicing functional medicine, The End of Alzheimer's was one of the books that I just fell in love with and just tried to learn everything I could.
Right.
And, and I saw it reverse 2 cases of Alzheimer's quite early in my career.
Mm.
And, but the more I never ended up shifting into just Alzheimer's work as a sole focus, because
Yeah.
I started seeing patients come in who had been seeing other practitioners trained in the Bredesen protocol with your experience. They were
Oh,
overtreated. They were taking supplements all day long, hurting their gut and other problems. It was extremely expensive. And they were all anxious and afraid. The
oh,
Bredesen protocol causes so much fear and harm to people. Everyone is so deathly afraid of getting Alzheimer's that they want to aggressively and militantly do anything they can to address any risk factor, but then they're left kind of a hollow shell. They're not living.
right.
And so because of that, I really stepped away from doing the Bredesen protocol. People come in and they think that they can only eat keto flex, right?
Right.
That's the
Right.
specific diet. And they're so fearful of stepping away from that. And if they're not in ketosis 24/7, and it's a mess. So one of the things that I'd like to see is kind of a Bredesen protocol 2.0, where what are the things now that it's been in circulation for 15 years, maybe now, 10 years, something like
that.
that. What works, what doesn't? What can we simplify and put aside? What can we keep? For my money, I think that they would want to really walk away from the optimizing the nutrient levels. There's a ton of testing and optimizing the nutrients. They would want to walk away from the excessive dietary recommendations. And I think that they should overemphasize the gut health, sleep, exercise, and then mold. So those are the things that I think are the most important pieces of that puzzle. So I'm glad you stepped away from that, because I think you're going to get equal risk reduction by simply feeling better and enjoying your life now that your gut is better.
And I mean, this is a common feeling that we all have, that none of us know how long we have on this earth, and to be obsessed, which I was, with diet and supplements and fear is, I mean, I'm wasting precious time, as opposed to enjoying my life and doing the best I can. And not
which I think you are now, and it's wonderful. Maybe one more quick question, and I'll preface this with, your father was a dentist, and I believe you grew up, swimming in tubs of mercury or rolling mercury around the table, playing with it. One of the things we found on your history was mercury exposure. And what are your thoughts on the work we've done with detoxing mercury?
Well, yes, I did have exposure, not just there. I mean, living in Florida, we had lots of pesticides. We used to run in the mosquito clouds, the trucks of mosquitoes, which was DDT. Cloud of mosquitoes coming from planes. We thought it was so cool. We had exterminators, anything to get rid of the mosquitoes in Miami. I thought it was fun. I like the smell.
I mean, it probably was fun. It's just not healthy.
Not so healthy. So, here I am, this kind of health nut with high levels of mercury. So we decided to start to address that as well. And it must be about a month and a half that we've been doing that. And I know you have me on binders, which I had been on before. So we're taking a little step back from the SIBO, not to overload my system, which I have had before, and try to very slowly detox from the toxins. There are others too. I know there are other metal toxins, high metal toxins that.
Yep. And just like there was an order for, working on the fundamentals, and then the probiotics in the diet and the herbs for SIBO, there's a bigger picture if you step back. You never want to just run into the detoxification work first. I think that was one of the mistakes your previous practitioner made, was assuming that you had to, hammer any mold and any mercury. First things first, I think, is getting you feeling better, more resilient, healthier, stronger, so that we can slowly then bring down the toxic levels. Because if you live in America and you lived in America for 3 or 4 decades, you've got toxic load in you. You've got metals, you've got pesticides, you've got herbicides, you've got plastics everywhere. And these things can be slowly pulled out, but there's a time and a place, and not everybody needs it, but you've got that Alzheimer's risk, and mercury is a risk factor for Alzheimer's. And so it made perfect sense for you, now that we had the gut kind of checked off and you're doing great, to move on to reduce the risk from the mercury. So actually, we hadn't had a follow-up, so I'm glad to hear you're doing well on the binders, and I'd expect nothing less.
Yeah, I am. I mean, it took a little while for my body to kind of get used to it, and then it did. And I thought, oh, good. And I just have this, every time I take it, I think, okay, I imagine all of those things just slowly getting out of me, just leaving my system. So it's
slow and steady. Exactly.
Slow and steady. I love that.
Steady. Yep. No need to rush. It took a long time to get in there, and we can slowly pull them out.
Yes, exactly.
Vicki, any closing thoughts?
Just that, I mean, it's not really a commercial for you, but for anybody who's considering going to see you, I would highly recommend it, especially if you've been down a road like I have and felt so frustrated and sometimes hopeless, like I'll just always be living with this. And again, I'll reiterate, just have hope. Don't lose that. because that mental piece is also huge. Having that optimism and knowing that there is an answer, you're going to get better.
Absolutely. Absolutely. Well, thank you for being here, because this, I think, is going to help a lot of people. I think a lot of patients with SIBO are going to have a big smile on their face and realize it's not that bad. And so, not the end of the world. There are worse things, and this could be fixed. So, thank you, Vicki. I am so grateful for you being here, and I will talk to you soon, I'm sure.
Definitely. Thank you.